Hello everybody, this is Dr. Jeffrey coming to you from Perceptive Health, and what I'm doing today is a short presentation on trigger point injections. So trigger points are a pain generator in the muscle that can cause quite exquisite pain, and we can relieve them with a needling technique called trigger point injections. So to really understand what a trigger point is, we really have to understand the anatomy. So myo is a muscle and fascia. So we are covered in fascia. So fascia is like our saran wrap. It is around our body that is holding our muscles and our nerves all attached to each other. So we have so they surround the joints, they form tendons, and they become ligaments. They are richly innervated with pain receptors. They are also important for posture, for movement, support, for balance, for lymphatic drainage. So the fascia is something we don't talk about a lot, but is an area that is also a pain generator. So that's where we get the term myofascial, right? The myo component is the muscle components, and those are really meant for kind of moving the joint. Now we have a syndrome that can happen when people experience chronic muscle pain. We call that myofascial pain syndrome. It is very common, and it is also often confused with something called fibromyalgia. It can be difficult to tell the difference between the two. But really the hallmark of myofascial pain syndrome is that pain in the muscles is the hallmark feature, whereas fibromyalgia has lots of other distinctive features like irritable bowel syndrome, fatigue, and other systemic complicated problems. So these are all the different types of symptoms that you can get and that you can experience with myofascial pain syndrome. So you can experience headaches, you can experience migraines, you can experience tendon injuries, so lots of different things. So trigger points are the hallmark of myofascial pain, and they are there's some pain just right here. So let's, with the trigger points, there's restricted motion, range of motion is what we see because those hyper-irritable areas don't like to move. We have a reduced strength, we have pain with movement, and we have referred patterns, pain patterns. So we have these unusual mimicking pain patterns with myofascial pain. So for example, the pain may be generated in the neck and actually go to the head and be felt in the head as a migraine or as a tension headache. We also have shoulder pain, knee pain, hip pain, sciatic-like pain. So these are common. 85% of the population has some form of myofascial pain. They may not have it to the point where it's myofascial pain syndrome, but these trigger points are extremely common. 85% at least have a trigger point, and that's why we go to the massage therapist. That's why we go to the yoga, because we're working these myofascial pain points out. It leads to decreased quality of life, anxiety, depression, and it even can send people to the emergency room. So we get the classic cramping that can occur, and they can be so painful, especially in a large muscle, that it can send people to the emergency room. We also get people waking up at night often with extreme pain, and that also too can be very disturbing in terms of sleep and quality of life. We see a huge dependence on medications because that's the standard treatment, really. You go to the doctor, you have this pain. They don't often diagnose myofascial pain, and if they do, it's often prescribed a muscle relaxant and other sort of a narcotic or something to reduce the pain. And that can lead to addictions, but it'll also affect the gut lining, the liver health, the kidney health, and it's not curative. So no matter how many times you take these drugs, they're not going to get to the underlying chronic problem. So people often have a chronic course of these trigger points, and until they're really addressed, they will continue to be there and cause aggravations. And they will ramp up in intensity during certain times, and they'll go down in intensity in certain times, and they become what we call silent. So causes. So these are the causes: repetitive use, instability in the joint from osteoarthritis or joint instability, just joint damage with wear and tear damage, postural, structural irregularities, walking patterns, injury, metabolic, not metabolic. So there is some metabolic factors like nutritional deficiencies, electrolyte deficiencies, that also dehydration, that also contribute to these, and most likely hormones as well. Okay, so what are the trigger points? So this is a picture which I like, showing a trigger point in the hip, and as you can see, the red, the X's are where the trigger points are, and the red is where you feel the pain. Isn't that interesting? So that's the glute minimus right there, and that's a stabilizer of the hip. So that's an area of which gets tight very, very easily on most people, and that can radiate. Look at that pattern of radiation. That looks a lot like sciatic pain. So this is just a picture of myofascial pain syndrome, and just trying to explain what a trigger point is. These are these bands of tissue that become almost like bumps. You can push on them and they feel pain, or you can push on them and you may not feel pain on the site, but you may feel pain on the head. But you can feel them on yourself. And this is the treatment. So this is a myofascial injection treatment, and it involves basically using a very, very small needle up to 1 to 2 inches deep to really dive into the muscle or the fascia. Sometimes we're just working out the fascia because it is a fascial point that is needing to be released. But these needles are placed in, and a small amount of saline solution. This is an electrolyte solution, sodium potassium chloride, or just sodium chloride often. And really what that does is it hydrates that trigger point, and physically manipulates the trigger point. We also can call this technique intramuscular manipulation, because we're using the needle to go into the muscle to manipulate it. We also sometimes call this wet needling. And we really just hit the trigger point and let it resolve, and it just releases. And sometimes we can get if we get the trigger point, we can get a dramatic reduction in pain. So these are the different referral patterns. It's interesting to see. So for example, this person had pain radiating to the back of the neck, right? And further evaluation revealed that they had trigger points in the trapezius muscle and up in the shoulder in the TP2 region, and they also had some down by the scapula. That was leading to this pain in the back of their neck. So this was neck pain. So this is an example of trigger points leading to headaches. This is in the again in the trapezius muscle, in more the cervical region of the trapezius muscle, and more deeper in the neck. And you can see that characteristic referral pattern: sinus pain, neck pain, jaw pain, all these headache band around the head kind of feeling. And that was that trigger point. Then we have rotator cuff injury. So this is can happen where you get the symptoms of rotator cuff injury mimicking So these are the muscles of the rotators that are then referring to the places like the lateral epicondyle, the lateral elbow, for example, the outer aspect of the elbow, and we call that tennis elbow. So a lot of people are complaining of this tennis elbow problem, and we've realized that the trigger points are actually in the muscles in the scapula area, in the supraspinatus muscle. Or you could get the trigger points that are generated within the lateral elbow, which it does produce pain to the hand, and that can produce golfers or tennis elbow. Very easily and effectively treated with trigger point therapy. And there's the classic sciatic pain. So these are some other ones that we see very, very common. Knee pain. So a lot of people feel like they have knee pain and it's felt inside the joint, and they don't realize that it's the muscles surrounding the joint that are referring to the inside, where the pain is referring to the inside of the knee. Then we have on the back, we have of the gastrocnemius muscle, we can have them. That's very common. The knees and the gastrocnemius muscles are very common locations because we're walking, we have inadequate footwear, we may be a little bit overweight, we may have instability in our joints, in our knee joints, so due to just wear and tear. So these are very common points of trigger points. And that's the outer aspect of the knee there. So that is trigger points and what they can do. Trigger point injections are very effective. They are by far the most effective method for removing trigger points. And after a few treatments, so generally we work on a series of 4 treatments and evaluate at each time to determine effectiveness of those treatments. And we have lots of self-care outside and also lots of internal nutritional approaches that can help complement this as well. So thank you for tuning in. Have a great day.